So I am going to pass it to Michelle from KDAT to welcome us all.
Yeah, welcome everyone. Thank you, Lisa. Appreciate that. So this is our November
Oh,
town hall.
and Michelle, if you're talking,
You can't hear me?
never mind.
Do you have me now?
Yes, that was my fault.
Yep. So welcome everyone to our November town hall for the community support waiver. We're really glad you're here. We have over 200 people that are interested in listening today. So we're excited to keep moving forward and share some more information with everybody. And then I'm going to turn it back over to Lisa to take us through, but I'll be listening in.
Thank you so much, Michelle. So today we'll talk about PCGs, as you might see the letters after my name here. So we'll talk about our role with this webinar today. And then we'll just have a short poll question, provide you with some updates. And then Anna, who's also on the call today, will be going over the administration process for the waiver and operation, as well as participant access and eligibility. And then we'll have next steps and wrap up. And like I said, my name is Lisa. And also with us on the call today, we have Anna Brooks, who is our waiver administration lead, and Audrey Davis, who also conducts stakeholder engagement. And in addition, we have two interpreters joining us today. Their names are Kelly, who's speaking now, and Jerry Ann. So thank you very much for your service. So PCG stands for Public Consulting Group, and we are a firm that is working with KDATs to help with the following for the community support waiver. So we are going to help write and organize the CSW. And we are going to collect feedback from stakeholders such as yourself. So thank you all for joining us today as we work through this process. And I'm going to hand it off to Audrey to help lead us through the poll question.
Hi, everyone. Like Lisa said, my name is Audrey Davis, and I'm also on the stakeholder engagement team. We're just going to launch a quick poll just so that everyone can, we can get a see of what everybody is. And so I'll read the poll question. It should have popped up right on your screen, but I'll read it out loud as well. The question is, which describes you best? A community developmental disability organization, a provider, self-advocate, parent, and there's more options that you should be able to see on the screen. So we'll leave this poll open for about a minute just so that everyone has the chance to respond. Also, if you cannot access the poll for some reason, don't worry. We're just trying to get a gauge on what members of the community are here with us today. Hey, Lisa, I see we have a lot of people who have participated in the poll. Would you like me to end the poll now?
Great. Yeah, I think that's a good amount of participation.
Perfect. Thank you so much, everyone, for participating.
It does look like we have a lot of providers with us today, so that's great. A wide variety of people as well. Okay, so I'm just going to talk briefly about some updates that have been made to the kansascsw.com website. So you'll be able to find on that website a new service definition page. And what that means is that we are placing all of the services that will be included in the CSW and the definitions of how those will be enacted. So we'll be able to review those and provide feedback on those as well. And from our previous town hall, we also have all the meeting materials up. So in case you missed it or want to keep updated and share the materials, feel free to head to the town hall section of the Kansas CSW website. And I believe now we're going to pass it to Anna, and she will share with us information about waiver administration and operation. So go ahead, Anna.
Thank you so much, Lisa. Hi, everybody. My name is Anna Brooks, and I would like to talk with y'all a little bit today about plans for the functional operation of the community support waiver, how it's going to run, and who's going to be involved. So for the operational coordination, this is a very simplified chart. Administration of the waiver is guided by federal requirements, but the system used by Kansas involves a lot of cooperation and a lot of communication to ensure that waiver participants are receiving the services that they need. The chart that's on your screen is going to give us a bit of an idea of how responsibilities are divided and the flow of communication between all of the entities involved. At the bottom, to start, we have the providers. Those are, of course, the people on the ground in direct contact with the individual administering services. They report up to the CDDOs and the MCOs, which work in tandem to coordinate care and to monitor the providers. The CDDOs and MCOs then compile information about service utilization and report to KDADS, who then shares the information with KDHE. The state will provide oversight, which includes quarterly meetings between KDADS and KDHE to review and discuss the waiver program. Here, they will monitor performance measures, and they may decide to make policy adjustments to improve waiver administration going forward. In addition to this system of checks and balances, I also want to note some hidden steps. There are a few steps that providers have to take to be eligible to provide services on the waiver. First, they have to register as a Medicaid service provider with KDHE. They also have to enter into service agreements with the local CDDO and contract with an MCO who's in charge of their provider certification. So MCOs will set and enforce training standards before any provider delivers services to a waiver participant. Next, the flow of contact for waiver recipients. All of that information, what does it mean for a waiver recipient? What is their experience like? I have created another chart. The first line of communication for someone who's going to apply for waiver services is going to be their local CDDO. The CDDO serves as the single point of application, eligibility assessment, and referral. So a person's CDDO will conduct an evaluation to determine their level of care and make a recommendation to KDADS regarding eligibility for the waiver. The CDDO will also talk to the individual about what they want. What does support look like for them? What do they need and what are their preferences? Using this information, the CDDO will connect the individual with their MCO, who will meet with them along with any family, caregivers, or support team members that the individual requests to create a service plan. Once the waiver recipient is satisfied with the plan, the MCO will work to coordinate care with the service providers. The individual will have access to their MCO representative at any time throughout the course of the plan year. So if something changes that would impact the level of need or access to services, the service plan can be reevaluated and changed to reflect that. Next slide, please. For participant access and eligibility, Let's talk about who the waiver is designed to serve. Quick little at a glance, it's a rundown on the scope. So the level of care level is set at intermediate care facility for individuals with intellectual disabilities. The tool for determination, we're going to use the Medicaid Functional Eligibility Instrument, or the MFEI, MIFI. The individual cost limit on the community support waiver is $20,000 per service plan year. And the capacity, we're starting with 500 individuals on this waiver for the first year. And then we're going to expand gradually, increasing by 500 people every subsequent year. A quick reminder that the waiver is designed to cover what the state plan does not. So even if you receive services on the CSW, you will still have access to state plan services. A little background on the general process. To be eligible for the CSW, you have to meet the level of care and be financially eligible. The level of care needed is determined by the assessment that we talked about, which is conducted by the CDDO. The assessment establishes a threshold of need, which helps us to tailor the waiver to target populations. Next slide, please. The MIFI, I'm going to say it like that because it's fun to say. The MIFI is a pre-admission screening and resident review approved screening tool that's used to screen for functional eligibility, including level of care. It's completed digitally using an online or offline software tool. CDDOs, or their eligibility contractors, will complete a functional assessment using the MIFI to determine if the individual meets the level of care for CSW eligibility. Like I said, the MIFI is a standardized tool used to determine eligibility and care needs. It gathers information on things like identification, services that are recommended, and the functional assessment. Next slide. Continuing, oh wait, sorry, back one. Sorry about that. Continuing to talk about the MIFI. The functional assessment is going to include cognition, communication, and vision assessments. We're going to look at mood and behavior and psychosocial well-being, the functional status, mobility, IADLs, ADLs, continence and health conditions will be factored in, as well as an environmental assessment and the existing social supports. More information on the MIFI is available on the KDAD's website if you're interested. For waiver eligibility, so the community support waiver is, it provides an opportunity for KDADs to offer a variety of services to help Kansans with IDD who don't require continuous 24-hour paid support. And for this reason, the waiver design is modeled after IDD requirements. That means that the scope will be 5 years or older. An individual has to have an intellectual disability that began before age 18 and or a diagnosis of a developmental disability that began before age 22. The individual must be determined program eligible by the Community Disability Determination Organization, the CDDO. I'm going to skip number 4. They have to meet the Medicaid long-term care institutional threshold score using the state's functional eligibility instrument. They must be financially eligible for Medicaid, and they must be a resident of the state of Kansas. I want to note, I skipped number 4 because we're reviewing that, and we may be taking that out. Also, I just want to note with final authority, I mentioned a number of times that the CDDOs are involved in the process for making eligibility determinations. The CDDOs will make recommendations to KDADs, but KDADs will make the determination, and the final authority specifically belongs to KDHE. think we've covered everything I wanted to give to y'all today. So I'm going to pass the microphone over to Peter so he can facilitate our questions.
Thank you, Anna. So I'm Peter Busby. I'm a communications manager here at PCG. You may have seen me on previous town halls if you've been here. But we're just going to open things up to questions now. So as you can see on your screen, there are basically two ways for you to ask questions. If you'd like to speak, ask your question in person, just raise your hand and someone will call on you and then give you the option to unmute, at which point you can ask your question. You can also enter your questions in the Q&A box. I see a few people have done that already, and we will read them out and answer them as they come in. So those are two options. So please, submit any questions you have. We are happy to answer them if we can. And for now, we'll just start with those questions that have already come in. So we'll start with, I believe we had somebody raising their hand, but it looks like they've lowered it now. So again, if anybody wants to raise their hand to ask a question, we're more than happy to answer those. So Anna, we've got a few different questions about targeted case management, right? A lot of people are curious how TCM fits into some of these processes you've outlined. So if you could just give a little bit more information about that, I'm sure a lot of our attendees would appreciate it.
Certainly. So I'm going to invite KDADs to weigh in if I have this wrong, but my understanding is that the TCM is either contracted by or employed by the CDDO. The TCM is going to be the person that the individual will interact with for their eligibility process. And the TCM, when they pass the individual over to the MCO to build their service plan, the individual will have the option to keep the TCM on the team to make that determination. So the TCM can also be a party involved in that discussion. Michelle, did I leave anything out?
Yeah, a little bit. You got it pretty good, Anna. But one of the things that the TCM does in Kansas is they work on and are responsible for the person-centered support plan. So they're with the team the whole way through. That PCSP would become part of the person-centered service plan. It's really inconvenient that we have the same acronyms for two different things, but we'll get that figured out. But yes, she'll still have the option to have a TCM. It is an option. It's a state plan service. No one's required to, but most people really like to have a TCM to help them navigate the system.
Thank you, Michelle and Anna. We have a question from an anonymous attendee about the difference between this waiver and the IDD waiver. So in general, we've gone over some of these differences in previous town halls. So I encourage you to check out that Kansas CSW website, review some of those previous materials, and you should get a much better picture, especially in terms of services and things like that, and how the CSW might differ from the IDD in that respect. Anna, I don't know if in terms of the processes you've laid out today, if there's any sort of differences between the CSW and the IDD that are worth highlighting here, or if things generally unfold similarly.
Sure. Yeah. The processes that we have built for the CSW are modeled after the IDD waiver for consistency. I would point out that probably one of the biggest differences, there are differences, but one of the biggest ones is the amount of money available. And the CSW, we're implementing it in order to try and alleviate some stress on the wait list for the IDD waiver. So people who may not need the full amount that's available on IDD could still be served using the CSW.
Excellent, thank you. I'm gonna keep you on the hook since I have you right now.
Sounds great.
A question from Lydia Brookins about institutional care. what does it mean to say that somebody must not require institutional care, but the minimum requirement says they must meet the threshold for LTC institutional care? So I know you said that bullet 4 we're sort of revisiting. You can just clarify that as well.
Sure. The exact reason we're talking about removing that bullet is because it creates this sort of vagueness, and it is it's an opportunity for miscommunication. So what we were trying to articulate was that if the services that are available on the CSW aren't going to be enough to meet the needs of the person, if their needs would be met in an institution and not what this provides, then we're not going to approve them for the CSW because it wouldn't be to their benefit to do so.
Okay, thank you. A couple questions I think I can take care of, but again, if I overstep, please, people with more knowledge jump in. A question about self-direction. If the CSW is going to be self-directed only or agency directed as well. So again, we covered self-direction during our previous town hall. I think our very last one, actually. So you can get all the information you want about self-direction versus agency directed just on that Kansas CSW website. If you go to the town halls page, you can find the slides and the video from that. So please check that out and you'll be able to find all your information there. A question from Jessica Dalton about providers. So who does KDADS envision to be the providers of CSW services? Are the CSW provider qualifications outlined anywhere? So that is something we are still working on. We're working on compiling those qualifications. And as with everything else related to this process, as we come up with those, we will make sure we publish those so y'all can take a look, provide any of your feedback. Obviously, we love to have it. Send it to us through that email address you see on your screen now, or by going to the Kansas CSW website and filling out our feedback form. So those provider qualifications are on the way. Obviously, we're considering how to build out our provider network to make sure we have people in place that can provide these services once the CSW gets up and running. Okay. So a couple questions, or at least one question here about the budget limit, the cap for individual spending. So Michelle, you're probably in the best position to answer this one from an anonymous attendee. Will that cap per year increase over time, or are we expecting it to remain static?
Yeah, thank you for that question. At this point, the legislature has set that cap at $20,000. And it's rolled over into the 2025 budget. I believe it will for the 26 budget. So this would be a legislative decision to raise that cap and will be based on budget considerations of the legislature. Now, I know there are a lot of people that are concerned that that's not enough, and I certainly hear your concerns, and that's something we'll have to work through. I think implementation of the waiver will give us a lot more information to share with the legislature if the 20,000 isn't going to meet the needs of the population it's intended to. But that's the information I have at this point.
Thank you, Michelle. I see quite a few questions too on the wait list, and especially the relationship between the CSW and the IDD with respect to the wait list. Again, that's something we are still working out, exactly what the process will be for potentially transitioning between those or how those wait lists will relate to each other. So again, we ask you to please just, give us a little patience. There's a lot of things for us to work out. And as I said, with regard to the provider qualifications, we will absolutely make sure that information is available to y'all as soon as it is ready. Michelle, anything to add, you wanted to say with respect to the wait list or the relationship between the CSW and the IDD waiver?
Yeah, as Peter said, we're just digging into that, trying to figure out how we're going to manage that. And we're looking at, other states and how they do that. right now. And so we're trying to get more information. And as we get that information, put together, we'll be presenting with this group and with the technical advisory group on, options that we can pursue as far as managing those wait lists. We also just completed a wait list study with KU, and they had some feedback for us on potential solutions on how to manage the wait list.
Thank you, Michelle. I see at least one question on the website and where to find those previous town halls that I mentioned. If you just go to that kansascsw.com, you should see an option in that top line navigation that just says town halls or something fairly close to it. If you click that, scroll down, you'll see all the videos, transcripts, what have you for the previous 2 town halls we've done. Obviously, this third one will go up there as well. So we do have a lot more questions in the Q&A. We have more time. We will continue to run through those, but I do see at least one participant has their hand raised. So Melissa Rooney, I will give you the option to talk now if you'd like to unmute and go ahead and ask your question.
Thank you. I am a facilitator for an SED waiver, and we have some clients who we share with the IDD wait list. I'm sure that our clients are a small population when it comes to the IDD wait list and the CSW. I just wondered if any thoughts or processes were looking at how to serve children or that this population, if they happen to get to the list. Right now, the list is so long that typically kiddos are aged out by the time they get to the ID wait list. They get to the top of the wait list, but hopefully that will be correcting. And I just wondered if there was any thought given to kiddos so far.
Mm-hmm. Melissa, thank you for your question. We appreciate it. Michelle, I saw you come off mute. I probably would have thrown it to you anyway, if you want to jump in.
Melissa, that's a really good question. There's a lot of thought being done with Kansas on our how we better serve everybody, but in Medicaid, but children especially. We're really looking hard at EPSDT, which is early periodic, oh my God, screening, diagnosis and treatment for children, and seeing how we can improve our how we are evaluating children for those services and having a provider network to serve those kids, and making that, so that we're wrapping all of those services around a child. So that may also help with looking at our kids on the wait list. EPSDT or state plan services may not be the whole answer, but they may be part of the answer to helping to serve these kids if they already have a medical card. And most people on our wait list do have a medical card. There's 70 to 75% of them already have a medical card. That won't really address those children that do not have one. But that might help with a pretty large chunk of the kids that are on our waiting list.
Thank you, Michelle. A question from Janet Bolander. I apologize. I feel like I could throw this to any number of you, so anybody feel free to jump in if you have the answer. Will all CSW service providers affiliate with a CDDO?
Janet, yeah, that is the plan, but they will go through the process of affiliating with the CDDOs.
Thank you, Michelle. Anna, a request for clarification for something you potentially said earlier. If the TCMs would be employed by or contracted by the CDDO, is that accurate?
So the TCMs would have to affiliate with the CDDO in order to provide the service. Some are currently working for a CDDO / community service provider. And we have a whole separate work group working on looking at the conflict of interest with the federal regulation and trying to figure out how we mitigate that that issue right now. But currently, there are quite a few TCMs that work with a CDDO or work for a CDDO, and so we're working through that with our providers right now.
Thank you, Michelle. Jermaine Mitchell, I see you posted a question about basically getting help with some Medicaid eligibility issues. So we can't get into that right now. It's just beyond the scope of the webinar. But if you see that email address on the screen, that kansascsw@pcgus.com, you email us. We'll make sure we put you in contact with the people at KDADS that can help you out with that. And then a question from Sarah Mai about, if potentially there are any issues with getting CMS approval for the waiver. Would it be possible, or would KDADS consider funding small pilot groups in the meantime to utilize some funding allocated for the CSW, at least to get some motion in place? Michelle, I imagine that, there are pretty strict guidelines on what the legislature has assigned this funding for. So it is fairly restricted to the CSW. If there's, KDAD's funding available for this other thing, I'm sure that's a much larger discussion. But I don't imagine the CSW funding could be moved around like that.
Yeah, I appreciate wanting to get this on the road, but we are moving as expeditiously as we can. Our plan is to submit the waiver to CMS fall of next year, and they require about 6 months to review and approve a new waiver. And so we're hoping, our goal is to launch in April of 2026. We already have our budget right now for fiscal year 25, and we don't have, to my knowledge, any funds to do some pilot work, but I can certainly take that back and see if there's any availability of that. I appreciate your question.
So a question from an anonymous attendee about helping families get self-directed care, and if there are any plans for sort of, increasing resources for that, excuse me. So I will say services, sort of self-directed care among them, as I said, were covered in a previous webinar. So if you want sort of information on how self-directed care might be covered under the CSW, that's a good place to start. As I said as well, we're still working on plans to build out the provider network. Once we have those qualifications, then we can start to ask, okay, how are we going to bring providers on board? So I think, the larger answer to your question is probably still in the works. But as I said, we'll make sure we get that information to you just as soon as we have it. Another question from an anonymous attendee about basically how does one get placed, on the IDD waiver or the CSW, or, who decides if an individual's needs are appropriate for which waiver? Michelle, I know we said at the beginning, we're still sort of working out the relationship between the two, but is there anything sort of like process-wise we could lay out at this stage?
Not quite yet. I mean, there's definitely a process for the comprehensive waiver that we have already we already have, there's, a waiting list, there's a crisis exception process, all that information you can get from your regional CDDO in their catchment area. But we're still working out all the nuts and bolts as far as what that's going to look like for the community support waiver and how that's going to interact with the comprehensive waiver.
Thank you, Michelle. I will say as well, I'm sorry to keep directing you to other webinars, but we've had 2 town halls at this point, so it might help, just going back and reviewing the different goals for the CSW. I mean, it has a specific mandate, so looking at that and comparing it to the IDD might give you a better idea, at least initially, of which one might be appropriate for the services you're thinking about. Anna, this one might be most appropriate for you. This is another question from an anonymous attendee. I assume, meaning you, Anna. So you, Anna, mentioned the eligibility specialist with the CDDO will make a recommendation to KDADS. Is there anything further we could say about this process right now and what it might look like? Like, do we know, who's speaking to whom and in what order, so to speak?
Sure. Yeah. Some of what they're going to be sending is the outcomes of the MIFI. I believe they also send the support plan documentation. So that's the part where they ask questions of the individual about what kind of care they want, what their ideal would be. Michelle, is there anything else?
Yeah, Anna, you're pretty much on the right track. When currently when someone has a basis assessment, that's what we're using now. That information is loaded into the state system called CAMUS by the basis assessor or whomever is loading it for them. And the CDDO collects documentation of the developmental disability as well. We determine, the state then determines if they're eligible or not. That process will look pretty much the same for the CSW. They'll have the MIFI, they'll be determined eligible or not eligible. The CDO will fill out what's called a provisional plan of care, which they will list down whatever services the person thinks they might want or might need, just to show us that, yeah, they're aware of what they're getting into and that there are certain services that might fit their needs. And then from there, once that's all with ineligibility, that's sent over from KDADS to KDHE for the Medicaid application. If there isn't already one in there, they turn around and then they make the person eligible. That information is then sent to the managed care organization, Sunflower or United, and soon to be Healthy Blue, whomever they choose. And then the service coordinator at the MCO will contact them and set up a time to start working through the person-centered service plan and getting services on their service plan. They will do what's called an assessment to help them determine what services the person is eligible for. And that, I know that's a long, drawn-out process, but these steps are in place to assure that we're making sure we don't, miss something. People don't get what they came to get. And if they're in the wrong place, we need to redirect them to another place. But we just want to make sure that everybody who's eligible for the waiver gets the services that they are needing.
Thank you, Michelle. While I have you too, I'll let you handle the next one from Ron Fugate. This is basically just a question about let's call it the legislature's long-term plans for the CSW. If we expect the legislature, to continue this funding and sort of continue to support the CSW long-term.
I don't have a crystal ball, Ron, but I know that everybody is very excited about the CSW. We put it in for our budget enhancements for FY26. We expect it to pass. Every year there's a new budget. Everybody at the legislature is very interested in it. The governor's office is very interested in it. Our congressional delegation in Washington has even shown interest in it. So people are very excited and really want it to go through. So my expectation is they are going to stay with this commitment to funding the community support waiver. And we'll be looking at it with a lot of interest as far as what it does to help alleviate our long waiting lists and provide services to Kansans that qualify for this waiver.
Thank you, Michelle. I'll give all of y'all a break. I'll handle the next two. So this is a question from Joanna Jeffries. If there will be a process to access the CSW for those in crisis and bypass the wait list, as there is for the IDD waiver. Again, I think this is one of the things we're sort of still working on. As I said, the relationship of the CSW to the wait list and the IDD waiver are still in flux. So again, that's an answer we hope to have for you soon, and we'll make sure we share it when we do. A question from Sarah Mai just asking about the deadline for sending suggestions for service definitions in the CSW. So, Sarah, this is a long process we're going to have to finally get this waiver approved. Or excuse me, I should say, just get it over to CMS and then eventually get their approval. So, you have plenty of time, let's say, to send us your feedback on those service definitions, and we would love to have it. So please just visit the website, fill out that feedback form, and I will personally guarantee we will read it and take it under advisement. Whether or not we implement it is another question, but we would love to receive it, and we will definitely take it into consideration. Okay. So a question from Craig Knutson about what is billed under the proposed cap, if state plan services like TCM will count against it or sort of other employment incentives. So I know we talked about sort of TCM and the relationship between it and the cap and the budget on previous webinars. I think, again, the very last one. But Michelle, you're coming off mute, so you get the responsibility. So if you want to jump in here, I'd love to hear it.
Yeah, sure, Peter. Just real quickly, Craig. The state plan services won't be part of the $20,000 cap. Those are just for the waiver services. Additionally, we do plan to have FMS as an administrative service instead of a waiver service. So that will take that monthly cost out of the cost of the waiver. So, we're trying to keep as much in the waiver as we can. Lots of services, but we're trying to, any kind of costs we can bring out of the waiver so that $20,000 goes further. We're going to try to do that as well.
Thank you, Michelle. Question from an anonymous attendee, just about sort of in general, if it's normal for there to be a cap on cost or spending for waiver services. So there are probably two answers here, sort of one with respect to KDADs and one sort of, let's say nationally, if we want to go that far. I think, Jackie, you're on the call today. I'll throw this one to you for your first question. I know you've looked at sort of waiver services in some other areas and in Kansas specifically. Could you just say, give an explanation if it's typical to see this sort of cap on cost or spending?
Yeah, thanks. I would definitely say that including budget caps is a common mechanism that a lot of states use for their waivers. You'll also see that states have waivers that some of them will have a cap and others won't. So that would be like Kansas, where they have a comprehensive IDD waiver that doesn't have that budget limit and are also implementing a CSW that will have a budget limit. So you really see across states the use of budget caps for certain waivers, and also states do include comprehensive waivers that don't have caps. So you see both.
Thank you, Jack. I appreciate that wider context for us. So question, our next few will all be from anonymous attendees. So on one of the slides, I apologize, I don't know which, and the question doesn't indicate which. Something was mentioned about KDADs having final say on approvals. The anonymous attendee would just like a little bit of clarification on that. If that means that KDADs will review and have final say on eligibility, whether you even qualify for the CSW, or final say on the actual services approved for that individual.
So
Sure.
can I answer that?
Please do.
Yeah, so it has to do with we are required for the state to make the eligibility determination in the end. So that even though the CDOs do the level of care and gather all the information on the diagnosis of the person to meet the criteria, in the end, the state has to make the determination of eligibility. And so KDADS makes the final program and functional eligibility determination, and then KDHE does the entire adds in the financial piece, and they are the ones that in the end are responsible for determining that everybody on that waiver or who has a medical card meets the criteria for being on the waiver.
Thank you, Michelle. I think your answer too points to the next question we have. So you may be repeating yourself, but I at least find such repetition helpful. What sort of information is KDAD's going to receive as part of that eligibility determination? So the attendee's asking if diagnostic information, such as an IQ evaluation, will be shared, or if it'll only be related to that functional eligibility piece.
I don't know that we have determined, that we will receive the diagnostic information internally. I know that there's talk about how we should do that, and I don't know that that's all been figured out, but we will be making the determination on the functional eligibility piece.
Thank you, Michelle. We have one more question so far that hasn't been answered. Again, just asking about the relationship between the IDD and the CSW. Again, I would say the town halls definitely go into this, especially the first one. So if you want to look at the goals there, you should be able to parse out some differences. Or if you want to go back even further, you can look at sort of the legislative mandate for the CSW and what their vision was for its creation. Either of those should give you some more information regarding what the relationship is between the two and why the legislature felt this CSW was necessary for Kansas. And then a question from an anonymous attendee about TCM. I apologize, anonymous attendee. I don't quite have enough information in the question to understand what you're asking. But if that is your question, just says TCM as well, please provide a little bit more info and we'll be happy to answer it. I'll also say at this time, I know Jackie at the very least, and maybe some other people have been going through the questions and typing out answers as opposed to doing them live. So if we didn't read out your question, I would check there first to see if somebody else has answered it. But we do have a few more minutes left. So if anyone else has any questions, please send them in now. We're more than happy to answer them. While y'all are typing your answers, I will just remind you that if you do have questions later on or anything you don't want to ask right now for whatever reason, you can email us at kansascsw@pcgus.com. Or if you visit that Kansas CSW website, you can fill out the feedback form and send us a little bit more formal feedback, either on anything you see there, service definitions, town halls, so on and so forth, or anything else you think we should hear as we're creating this CSW. I will say as well as one more final plug, I imagine most of you who've joined us today are part of the mailing list for the CSW. That's probably how you heard about today's town hall. But if you aren't, if you go onto the CSW website, you can sign up for that mailing list, and we will make sure you get updates on town halls, new portions of the website, any new information we release that we think it's important for you to see. So anonymous attendee, thank you for clarifying your question. Basically, again, we just want to repeat, Michelle, if TCM will or will not be counted against that 20K budget cap.
My understanding is it will not at the state plan service, and that the waiver, and they will build, and TCM will have to build the state plan through the MCO, and that the waiver costs are what we're talking about when we talk about the $20,000 cap. I will go and try and double check that, but this has always been my understanding.
Question from Sheila Gosha. I apologize. Go to Sheila and anyone if I pronounced your name incorrectly during this webinar. Sheila's just asking if the questions and answers not read aloud will be available on the website. I believe we've answered everything. I don't think there's anything we didn't cover. Oh, thank you, Sheila. So we will make sure we comb through the questions and see if there's anything we didn't read aloud. We'll make sure that information is available somewhere on the website. But my hope is we've covered everything. So that exhausts all the questions. I will give one last call. We have about a minute left before we have to start our wrap up. So if anyone wants to get those last few in right now, here's your chance. Sheila, another question. Yes, if anybody sends in questions after the town hall, we will make sure those get posted again somewhere in the website. We don't yet have a formal area for answering such questions, but we make sure, again, the person who asks it gets an update, and we will update any content on the website to make it more clear, include that answer if it's not there already. So at this point, that ends our question and answer period and brings us to our final wrap up. So Lisa, I will throw it back to you to finish things up for today.
Thank you very much, Peter. Okay, so our next steps, hold on just a moment while I navigate my screen here. Great. Okay, so regarding our next steps, on the website, as we talked about before, there will be service definitions. So we just wanted to provide some brief guardrails that will be helpful for those wanting to provide feedback on the service definitions. So constructive feedback looks something like, please clarify which entity or person will work with the waiver recipient on this specific step. So saying something like, this is confusing, I don't understand, while we will address that, is not necessarily the kind of feedback that we're looking for. Like something specific will help us to specifically design this waiver to benefit the most people. So when you're considering feedback, just ask these following questions. So, are there opportunities for additional support? Do you have any concerns with the eligibility standards or process? And what are the strengths and weaknesses of the waiver? So those are just a few questions you can consider. And while we definitely take any kind of feedback, this will just help provide a structure. And this is the first of many steps. So any commas or misspellings will likely be corrected during the process, so you don't necessarily need to point those out at this time. And I will just take a moment to address Martha's question in the chat here regarding, she asks, will the $20,000 cap be revised with inflation, wage changes, etc.? So we don't quite yet have an answer on the revision, but we do know that the legislature has set that $20,000 cap. So any change, including the inflation, would need to come from the legislature as they have directed it. Okay, so it is 3 o'clock. We've reached our time. So thank you very much for joining us. Thank you to our interpreters. Thank you to KDADS for providing answers and helpful ways for us to engage. So we will be in touch with the next town hall information. So thank you all for your time today.
Thank you.